Hello and welcome to rePRO Film Festival by mama.film. I'm Leila Meadow-Connor.
I'm Mallory Martin.
And I'm Debbie Samples.
As the founders of rePRO, we thank you for joining us for these call to action conversations. We want to thank the village of people who have made this festival possible, our filmmakers, special guests, partners, sponsors, and of course you, our audience. You've let your time, talents, and expertise to help amplify the voices that are so crucial in the fight for reproductive justice and bodily autonomy.
When you purchase tickets and donate to rePRO, you become an active participant in change, as all net ticket sales and accompanying donations support our 5 beneficiary organizations. We thank you for participating in these vitally important call to action conversations and hope you leave feeling empowered to be your own advocate in the world.
Please keep women's reproductive rights at the forefront of your mind as we enter this critical election season. We're pleased to present the rePRO Justice for Women of Color Call to Action conversation, moderated by Tammy Boyd with Black Women's Health Imperative.
Thank you, rePRO team. My name is Tammy Boyd, and I am joined today by some exceptional individuals who will be speaking with me about reproductive justice for women of color. As a reminder, this is a call to action conversation, and it's really meant to amplify the reproductive healthcare injustices faced by women of color across America. So I'd like to introduce our special guests. First, we have Mrs. Frances Mills. She's the director of Cleveland Office of Minority Health and co-chair of the Healthy Neighborhoods Committee of the Healthy Cleveland Initiative. We have Nourbese Flint, the program manager at Black Women for Wellness in Los Angeles and the executive director of the Black Women for Wellness Action Project. So let's get started. Our first question, it goes to Frances. Tell us a little bit more about the Healthy Neighborhoods Committee and its involvement with the short film Toxic, A Black Woman's Story.
Sure, I'd be happy to, Tammy. Toxic, A Black Woman's Story was born from the local issue of infant mortality among African American women in the city of Cleveland. The Healthy Neighborhoods Initiative is a project that's really the health promotion arm for the city of Cleveland. And we work on areas like developing messages around social determinants of health, encouraging the increase of tobacco cessation services through our Breathe Free committee, looking for ways to improve health literacy among residents in the city of Cleveland through that committee, a healthy eating, an active living committee, a committee that addresses community violence, and a committee that looks at behavioral health issues. The Office of Minority Health is the intersection within the health department because our whole sole role is to look at the impact of health disparities among communities of color in the city of Cleveland. In 2017, the city was experiencing unprecedented high numbers of infant mortality in the African American community, and our leadership at the health department corralled us and said, hey, let's get all of the Healthy Cleveland committees to really look at supporting some aspect of reducing infant mortality among African American women. We had far exceeded the Healthy People 2020 expectation of 6 deaths per 100,000 live births, babies who died before their first birthday. Now, in our Caucasian community, the infant mortality rate in 2017 was 2.4. For African American community, the infant mortality rate was 16.1. And so that was just absolutely unheard of. And it was a call to action for us. And so the committee said, we want to take a look at discovering what are some of the root causes for these issues, because it's easy to say that, well, African Americans have lesser access to healthcare, or African American, this is a poverty issue among African American women, when in fact, the data was pointing that infant mortality across the board for African American women, it did not matter what level of education that you had. You could be a PhD making a 6-figure income with what is identified as a stable family, plenty of access to healthcare, and still experience infant loss. And so we started our work by doing focus groups with women who had lost children over the last 5 years. And what we found was astounding on many levels in terms of just the resources that were made available to women and families, the type of care that they felt that they received while they were in care, and just really no recourse after they had lost their child. And so we said we wanted to do a script that really examines chronic stress, racism, and its impact on birth outcomes. And so that's the sum total of the film, that intersection, and how African American women particularly are treated in the healthcare profession. And so when we did this focus group, we found that every woman who had lost a baby said they had never received a referral to spiritual care, to therapeutic care. It was more or less, a baby died, your appointment is in 2 weeks, let's just move on. And women just really feeling like they were not heard by their healthcare professional. And so we said that we would really put those issues in the script and then look for a funder to support the work. And so what we did was we sat down as a committee of professionals, individuals who work in nonprofit, individuals who work in hospital systems, and we wrote the script out. And we argued back and forth at the table. And we had men at the table, we had white women at the table, we had African American women at the table, and we put the script on paper. And we were fortunate enough to receive funding through First Year Cleveland. And that's when the film really began to take a life of its own. We wanted to make sure that it was a local highlighting of local talent, from our producers and our directors to the actors and actresses who portrayed our primary characters and our extras, to the development of the film guide, which we had some assistance from the National Geographic, to the final production. And so it was really a labor of love on the part of the committee, who were very valiant. About 12 people put this script together in the film guide. And so that's how we arrived at the final end product that people will see, Toxic, a Black Woman's Story.
That's wow. That's very impressive. For those in the audience who haven't seen Toxic, a Black Woman's Story, please definitely go, out and watch it. The link on the website. Before we get started, I also want to bring in you, Nourbese. Can you tell us a little bit about the Black Women for Wellness and the Black Women for Wellness Action Project? And then also you have this really exciting campaign about You Deserve the Best. Can you tell us a little bit more about that?
Yes. So I will start with Black Women for Wellness. Thank you, Tammy. So Black Women for Wellness, we are a 501c3 Black women's reproductive justice organization located here in Los Angeles. And just like true reproductive justice fashion, we do a spectrum of work from regular old reproductive and sexual health work, when you think of traditional rePRO and sex health and education, to maternal and infant health, to environment, to criminal justice, to organizing and civic engagement. And so I feel like we're kind of the one-stop shop of Black girl magic in California. Black Women for Wellness Action Project is a newer organization. It's a 501c4, which only really matters if you're into IRS law. But the difference there is that we're able to do, we have another tool in our tool belt to hold folks accountable to Black women and girls. Mm-hmm. One of the things that we have been doing for a long time was organizing folks on the 501c3 side. And when it came to election season, we weren't able to say which candidates we think were great and which candidates we think were not so great for Black women and girls. And so on that side, now we're able to do and say that during election season and support candidates who we think are good, and and hold other folks accountable who we think are not. But we also decided that we wanted to work in culture work as well. And so out of the Action Project, we are also doing work that looks at changing the conversation, the images, the just uplifting a different view of the lives of Black women and girls, right? So we're trying to reimagine what that looks like and actually have people be able to have tangible things and ideas of what that reimagined world would look like. So that's in short. We have I think I mentioned this, but we have an office in Los Angeles. We have an office in Stockton. We do a whole bunch of policy work, which is my baby. And, we just up here trying to get the dream.
Right. So this is great. I guess also, Nourbese, we're both a part, Black Women's Health Imperative, and your organization are both a part of a group called In Our Own Voices. Can you tell us for the audience, the difference between reproductive rights versus reproductive justice?
Yes. And so, where to start? There's whole papers written on this. But for example, we hear reproductive health, reproductive rights, reproductive justice a lot of times, and people use them interchangeably. But reproductive justice has a very specific meaning. So when we talk about reproductive health, when we think about reproductive health, we're thinking about the actual health services of things that cover swimsuits, right? So if it's covered by a swimsuit or a bikini, that is reproductive health. It is the services that we are looking at. So you're thinking of healthcare, you're thinking of birth control, that's reproductive health. Reproductive rights is laws, policies, court cases that we think about. And those are the things that actually have to do with your rights, right? So think of laws and policies. Reproductive justice is something that actually started by Black women, right? And it was a gift to the reproductive movement when it looks like, or when we wanted to have a different way or a different framework of talking about the things and issues that impact Black women. So it started about in 1994, it was coined after the Fourth World Conference for Women's World Conference in Cairo. And it came after that. Really, women, and particularly Black women, were not being seen in the civil rights movement, and they're not seen in the feminist movement, where in one space they had to pick their gender, and the other place they had to pick their race. So what it did was created an intersectional framework that was based in human rights to talk about everything that has to do with having a child, not having a child, and being able to raise your family with dignity and respect. So that means we talk about reproductive health and rights, but we also talk about the environment. And if you have clean water to drink, or if you're able to walk outside and not get harassed by police officers, or if you're able to get healthcare that is not full of implicit and explicit bias, right? So all those things are important if you're able to raise a family. And that is the reproductive justice that is centered in the lives of folks of color.
Thank you. That's a great, I think you articulated that very well. And I think an interesting point, it takes into account other social determinants and also other factors in reproductive justice, which leads to Francis, you also brought up in terms of how you had your focus groups and you guys looked at social determinants of health, but then also you said even for Black women, if you want to elaborate on that, for Black women, even when you control for education and income, that the rates seem to be still they were disproportionate for Black women. And then in the film, which is very interesting, great film again, implicit bias. Do you want to talk about how implicit bias also plays into the work that you do, and then also how in the film, implicit, there were definitely undertones of implicit bias in the film as well.
Well, one of the things using the film as a learning tool has been immensely helpful. because when you talk to primary care physicians, they say, oh, these things, the types of things that you describe are absolutely unheard of. Women would never be treated this way, when there's a whole host of women who say that they have been treated this way. I tend to lean toward going with the lived experience of people rather than individual perceptions about what does and does not occur, because we wanted to get at the root cause, okay? And we also wanted to bust those myths about poverty, about education. And so we were very intentional in our decision to show a well-to-do family, a two-person family, a family whose child is private school educated, but also we wanted to highlight those experiences in terms of what happens when those microaggressions of racism enter into our daily life, and the resultant stress that happens that really culminates with the lead character, her experiences with her physician, mirrored exactly what women told us, that they simply have not been heard in the healthcare profession, that their pain has been minimized when they've tried to tell their physician that something is not right, how paternalistic the responses have been amongst physicians. And so what we see as a result, are we seeing babies dying that could they have been prevented? Probably a great deal of them. And we see women dying who, this is our maternal mortality is reaching epidemics among Black women for exactly the same reason. And so this film becomes a teaching tool about implicit bias. Physicians react when they see Dr. Gupta and her reaction to the patient. They say, well, that would never happen. But we can ask those questions. Well, what is your protocol around how are you treating high-risk pregnancies for women who are in your care? And that you must ask those social determinants of health questions to every patient that's in front of you, because you're never going to be able to reach positive health outcomes if you don't address the whole person. And so that sort of was the message, and how each of us have some level of bias that needs to be addressed, whether we want to admit it or not.
Yes, I definitely agree with that. In terms of implicit bias training, and this is for both of you, are there suggestions on ways that we can address implicit bias training? For example, is that, implicit bias training in medical schools? But what are some suggestions or thoughts that you have around the implicit bias training? And that's for both Frances and Nourbese.
I could start, and then Ms. Frances can go. But that's a really good question, and that's one that we had juggled with in California last year. And so we actually passed the California Dignity in Pregnancy and Childbirth Act, which went specifically looking at what does it mean to tackle implicit bias within the health system where it is, right? Because we saw some movement for folks in medical school, right? But we're thinking, well, what about the folks right now? Because the same issues that were happening in Cleveland were happening in California. And what I would say also, what made it even more kind of starking in California is that we were able to actually reduce our maternal mortality and reduce our infant mortality. But for Black women and Black babies, those disparities of us dying at higher rates, 3 to 4 times more or twice as more in infant mortality, were still the same. So we wanted to show, like, look, we did all the other things. There is something else happening, particularly for Black women and babies, and we need to address this, and we know that it's racism in the system. And so we put a bill together that had racial justice implicit bias training, right? That one that made sure that folks are getting tested for the implicit bias, because we had the same problem with folks saying, oh, that'll never happen here, and we will never do that. And we're just like, oh, so we just making this up? What's going on, right? So folks to take the test, right? But also thinking about making sure it's a whole team, right? Mm-hmm. Because it's not only the physicians, it is the nurses, it's the person that check it in, it's the hospital administration. There is biases and racial discrimination going on between staff, right? And so we wanted all that for people to have those conversations, right? But we also know that even though we're pushing for folks to have this testing, for folks to have this training, and they need to have it on a regular and consistent basis, because it's not just something you do once and then be like, I got a certificate, I'm not racist anymore, right? But like actually having to do something continuously and growing, right? That we also know that that wasn't enough, right? That we also need to look at our full system and how racism happens in all structural places. So those social determinants of health, absolutely, right? And the people need to be asking those questions, but how are we also getting more folks of color, more folks from the community, as doctors, as physicians, as nurses, right? In those spaces? How are we also looking and examining, how people are coming in their everyday life? How we holding folks accountable, right? So like if someone says something like this happened to me and you didn't listen to me, what are the ways in which we have conversations to hold those people accountable and for them to change? Because it's actually really difficult to do that, right? And so those are the bigger conversations that we're having about it. But I think the one thing that we were trying to be very explicit about is calling racism out in the system, and any implicit bias training needs to call racism unapologetically, to say like there is something that is happening to Black women that is not happening to other folks, are happening to Black and Indigenous women that are not happening to other folks, and we need to examine that, and we know that there is racial bias happening.
I agree wholeheartedly on all levels that you said. Respective to the toxic film, one of the things that has come and evolved out of that work has been certainly the funder for the film, First Year Cleveland, is a collection of many, many different organizations that have said very upfront that racism is a problem, certainly in the maternal child health sphere. But also that, okay, this film becomes this teaching tool. Our hospital systems all agreed that their employees would make available implicit bias training for their staff. And it does go beyond the physician to the nursing, to the social worker, to the spiritual care, to the billing, to the front office, all of those folks. And so they've made that commitment. But in the larger context, in our community, very recently, our city council just declared racism as a public health crisis, as well as our county council also declared racism as a public health crisis. And so with this work, I am anticipating that the accountability that we talk about that needs to be in place, examining what is happening across all systems, not just the healthcare system, that has a negative impact on the health of communities of color. Those conversations, once you call it out, then you have a whole lot of work to do to make sure that those accountability measures are in place, including the collection and the reporting of data and the system for accountability. Because what we tell patients is that you have a choice. A patient can say, I'm not being treated fairly. Well, what is my recourse in the hospital system? Well, there's a patient experience office, or there's an ombudsman within the hospital. We encourage people to take advantage when they feel like they have been treated unfairly, and then to understand that the physician is there to serve you, and that you know what's happening with your body in a way that nobody else can know. And so at the end of the day, you have a choice to say, I need something different and I need something better. And that's the empowering message that we have to keep saying over and over again, that there's a better way to do this, and there's a certain way that you must be treated in healthcare and any other system that you encounter.
Yeah, that's excellent. That's very true. I think one of the things that both of you all mentioned some level of empowering Black women to sort of advocate for themselves, and I think film is definitely a powerful tool in sort of showing and demonstrating, a pain that a Black woman may feel, or just the stories of Black women. As it relates to infant mortality, I mean, we also know there are concerns in terms of Black women having access to abortion, contraceptives. The maternal mortality rate is 3 to 4 times higher for Black women in comparison to their white counterparts. And so in terms of empowerment, can you talk more about, so has your film been used, for example, as we approach November, as a way to hold our elected officials accountable? I'll just say, for example, as a little background for Black Women's Health Imperative, we put out a document called Black Women's Vote, where we highlight, and obviously infant and maternal mortality are in the Black Women Vote document, but we have like a report card where you can look and see where you can take it to your elected official and see where they stand on that particular issue. And that's also a way to hold your elected officials accountable. But your teaching tool in the film in Cleveland, are you working to also use a tool, the film, as a way to educate Black women about, being empowered, in terms of for their elections, not a particular candidate, but just in terms of just generally for holding elected officials accountable, as you know, on the federal level, but there's also the state and local, which is just as important as the federal level. And so I want to just hear from both of you all about what's happening in Cleveland and also in California. I should say Ohio and then also California. Nourbese, yeah. Either one of you can go first.
Sure. So I'll talk a little bit about, the short answer is yes, right? We are absolutely using all the tools in the tool belt to figure out how to not only empower, but create accountability to Black folks in California. I think that, a lot there. First thing, LA County, California, we have some crazy important elections, and we have ballot measures that can impact the lives of a lot of folks here, right? And so we are always using all the tools we have. We're working within our own voice with the I Am a Voter campaign. We have our own program called REAM, which is Voting Rules Everything Around Me. If you know Wu-Tang Clan, that would make sense. But it is a place where we are using our vote not only to build, to get people out to vote, but to build accountability. One of the conversations that we always bring up is that Black women vote, right? Mm-hmm. We vote in high rates. We were outvoting everybody in 2012, right? But when you look at the rates of us in terms of our vote, from 92 to now, you see a kind of a line going up with a teeny dip in 2016, right? But us pretty much going up in the amount of rates that we're voting. But when you look at our health disparities, they're going down the other way, right? And so there is a disconnect between our voting and actually it paying off for us, right? And so there was some research that came out that showed when people were making political decisions, Black women were the least thought about at the table, right? So for us, it is not only voting, right? Because voting is our entrance. It is kind of what I say, it's like your gym membership, right? You can buy it, but it doesn't have you like being fit, right? You have to go and work out. That is our vote. Our voting is when that's our entrance fee, right? But then we got to do the accountability work to remember that we put folks into office, and we are the ones to make sure that they stay in office and we can take them out, right? And those are the conversations about what are you doing for Black women? What are you doing for Black families? What are you doing for our families in general in our communities, right? And we need you to show up, and not just when it's election season, we need you to show up year round, right? And then when it comes to a film, when we're thinking about it, it is deeply, deeply important for folks in the social justice space to be thinking about how we are having conversations in the cultural world, in the pop culture world. A lot of times we're in this space of being like, oh, well, that's not us. We don't do those things, right? We're just going to stick to policies and these very strict programs. But we are missing our folks, right? If you are doing your work, you got to be able to reach outside the bubble, reach outside the people who are agreeing with you, and to the folks in the community that need your help. And one of the best ways to do that is through film, television, arts, other culture, things that we use and absorbed at a macro level in order for us to get those conversations out. Mm-hmm. And so we, one of the things that we did, and I'll wrap up in a second, is You Deserve Better, which you asked me earlier about. And that was a film that we put, it was a speculative fiction film. So it was a horror show, short film about crisis pregnancy centers. And we used that as a conversation to launch conversations with folks in our community, because when we had conversations with Black women, we did our focus groups, they had no idea they existed, right? But after having, showing them a short film, they're ready to organize and activate. They're like, who we need to talk to about this, let's go, right? And so using film as a way to organize people, to show folks about conversations or things they had not been thinking about in order to activate them, not only to vote, but to do what they need to do afterwards, is extremely important to how we are moving. And it also makes us, or has us, gives us the opportunity for us to reimagine what that world could be like, and actually have some meat on the bones when we think about what our world can be. I'll stop there.
That's great, thank you. And I know we're before we run out of time, I do want to ask a question for Francis and spend a little time on the film. As again, we've said throughout the conversation that film is just such a powerful tool. But in the film, there were varying themes. I mean, today we seem to focus more on the implicit bias aspect. But, even there was a part when, the lady, she's picking up her son, and the son and the principal or who at the school is saying, you need to, we want him to cut his hair. And, there was just a lot of different things. But I don't know if you want to kind of talk about, how you came up with some of the things in the film. How long did it take? You selected a director. How did you go about selecting a director, et cetera? I'd just like to hear a little bit more about, the making, quote unquote, of the film, and then also just the varying themes in the film.
Well, the varying themes came straight out of the lives of the people who sat at the table, and also straight out of current events. And so we wanted to really express the pervasive nature of racism and that impact that it has on how we parent, the impact that it has on our children in terms of just walking around being free. There's a scene in the film in which the main character's son wants to go to a skate park, and his mom is saying, well, who are the parents that are going to be there? And he's saying, well, we don't need any parents. It's a skate park. And she said, well, what if trouble happens and you'll be the only one that will have negative consequences because his peer group is primarily Caucasian. And so what is the impact for an African-American mother who has Black sons, what is their concern? Racism impacts that. And so bringing those stories to the table, there's a very interesting scene in the film about hair and what some African-American women struggle with in terms of, what is going to be called appropriate in their workspace around appearance. And so these were questions and issues that came up at our writing table. And then we had arts people who have been a part of our committee since its inception. And so we had people who have produced and directed films. What First Year Cleveland brought to us, they wanted to make sure that we had an African-American perspective in terms of additional directing work. And so we located a local African-American film director to work with the person who was already at the table. And just every process, our planning committee, we vetted we went to those auditions. We said, this is a person that we think will fit and who will be able to convey the message. And so we had those conversations with the staff. And so that whole process, local thought, local built, local message, that's really a national message in terms of infant mortality. And then racism is a worldwide message that this impacts quality of life across the board for African-American men and women. And it is something that has to be addressed because we operate in a way where we're not empowered to be and to actualize as much as we can. And as major contributors to particularly this US history, it's a shame that it hasn't been addressed at this point.
Yes, I definitely agree with that. And so with the little time that we have left, can I ask both of you, what can our audience do? What can women do? What is the call to action? If you could pick one or two call to actions for the women who are watching this. I guess we could start with you, Francis, and Nourbese, just, call to action for Black women around this issue.
And for me, the single most important thing for me is to raise up your voice, call a thing, but to vote. We have got to convey the message of voting and completing the census more now than ever before, because there will be very little recourse if we don't show up in a real way and really understand the intersectionality of the impact of race. Well, okay, I may support reducing infant mortality, but I don't support other aspects of reproductive health. We've got to get over those kind of barriers, because I always say they're coming for all of us across the board. And so in order to do that, we have to band together and we have to know when to speak in a unified voice. And our unified voice and action has to be through the vote.
Snaps, Francis. Go ahead. So everything of that, I think the thing that I would also add, I would add two things. One is do something. And I know that sounds super simple, but I think a lot of times folks get stuck in trying to do the macro and then don't really do anything. You can start with your own families, your own friends, your own neighborhood, and have those conversations about racism, have those conversations about voting, have those conversations about candidates. You can do all of that within your house, but you got to do something, right? And do something when nobody's looking. A lot of times we have folks who are like, well, I do this, and they stump for the gram on how great they are. They'll come out to the protest, and then that's it, right? Like, the work is what you do every single day. So if you are really an ally, if you are really about trying to dismantle a system and build a new world, right? Then we need you working every single day. And it doesn't have to be big. It could be just as simple as someone tells a racist joke at your office, to call it, right? Or if like a Black woman says something and like nobody listened to her, to point that out, right? And say like, yo, we need to pause and see what just happened here. Those little things actually make a lot of difference in terms of how we collectively think about how we move forward. The second thing I would say, and this is particularly for providers, particularly for folks in positions, we need to stop trying to fix social problems through people. So what do I mean by that? That is the idea of, particularly if you take maternal mortality, which is something that we had talked about today. The issues around maternal mortality are mostly social determinants, right? So it's racism, it is poverty, it is housing, it is all the things, right? It is not, we need to make Black women stronger, right? And so we need to start thinking about how to fix the education system, fix the housing system, fix the economic system, make sure that we're getting our whole dollar, not 64 cents, right? All those things before we try to like fix Black women, right? Because we're not the problem, right? And so we need to be thinking about how we are fixing social ills to create the world we want to see, not fixing the people for they can be stronger, better, harder, whatever, in order to deal with the social problems in our lives.
And so making that shift from the individual, because we like to focus on the individual, and focusing on the systemic, which that's where that has been the source of the problem, and it is going to be the solution. So I agree.
Mm-hmm. This is fabulous. I definitely agree with both of you. I'm a little biased. I'm a policy person. I think policy definitely drives change. And so that's why it's also really important to link policy to voting, making sure you get your right elected officials who really mirror the policy that you are looking for. And so we've heard, in terms of the call to action, we've heard raise your voice. We heard, have the conversation, do something, make sure you fill out your census. And then obviously most important is to vote. And so I definitely want to commend the Cleveland Office of Minority Health and really what you're doing and really taking a look and shining a bright light on infant mortality. Again, the film is very powerful. And the Centers for Black Women's Wellness, one of our reproductive justice partners, want to commend you as you do excellent work there in California. And we love amplifying your voice and want to be helpful to you. And I think that concludes our conversation. I don't know if do you all have anything you would like to say before we end today?
I have one thing, just to look for your policymakers within your local government, your state government, who are like-minded. We're very fortunate in Ohio to have a Black maternal health caucus, and we have dynamic state representatives and state senators and congressional leaders who support a Black woman's agenda. Look for those people and align with them and partner with them and have them support your issues at the local level. They will show up. They will lead and facilitate conversations. They will point you in the direction where you can have more tangible resources. Link up to those who are like-minded.
Yeah, and I would first ditto that. And then I would also say that the moment is now. Mm-hmm. This is the time that we need to be thinking about how we want our future to be. Dr. Ruha Benjamin, which is, again, one of my favorite people in the world, talks about power is being able to dream for tomorrow, right? And that the folks that our future is not just by happenstance, it's people create the future. So what somebody else's dream is somebody else's nightmare, right? And so if we want to change the nightmare, which I believe I am in a nightmare, we got to be able and start thinking about how we want to architect the future for what that looks like for us, right? And then lastly, join an organization and be involved, right? So you can come holler at Black Women for Wellness if you're in California. It sounds like the office in Cleveland, y'all doing some amazing stuff. I got family out there, well, in Akron, so it's like 30 minutes away. But, help be with people, like make sure that you are showing up every day. And join, and like, we need your help, right? I'm sure the sisters in the Black Maternal Health Caucus, I'm sure they are putting in hella work and could probably use somebody's hands, even if it is just to do thank you cards or make phone calls. So, come through. That's it. And thank you, Tammy. It's good seeing you.
Nice seeing you too. Well, thank you. I mean, I know you have to go to another engagement, for instance. I don't want to hold you, and we could probably go on and on. This is an excellent conversation, and it's just so timely and so important, as both of you have said. And you, again, the audience, you can do something on the local level. It's not just something in Washington on the federal level. Each one of us can do something on a local level and hold our elected officials accountable. Thank you.
Thank you.
Thanks. Nice meeting you, Francis.